Sleep apnea is one of my passions, and why it's one of my passions is I was recently diagnosed last year with sleep apnea. And why it's a major issue is if you do have it, it will take off about 10 years of your life, okay? Some of the risk factors include snoring. So if your wife's complaining of you snoring, that could be a major issue. If you have high blood pressure, that can also be a major issue. And if you also just never feel like you're getting a good night's sleep, okay? Yes, you may be working really, really hard, but it may be sleep apnea. It may have an underlying condition that you don't know about, okay? So plenty of people sleep throughout the night and never really realize that that's what's going on, okay? So what exactly is sleep apnea? It is where during the night you stop breathing or you really don't get enough oxygen to the brain, and so it doesn't allow your body to fully relax, okay? And because of that, it's like running a marathon throughout the night when you're supposed to be resting and recovering, okay? So one thing that we can do in the dental office is we're looking in the mouth. We can see different things such as clenching and grinding, which is another risk factor. We can see the wear on your teeth. We can see if your tonsils are inflamed. All these things can sort of point out that there may be something else going on, and we'll sit down and talk to you about what's going on, what we're seeing, okay? What we've also done is we've reached out to our medical professionals, and we've actually developed people that we can refer you to so that you can get the appropriate care. Okay. With sleep apnea, it does have to be diagnosed with a medical professional, but a lot of times we can pick up a lot of these symptoms, and I can't count the number of patients that I've sent over there and they're like, wow, doc, I have sleep apnea. Okay. And why I love being able to treat these patients so much is because it's night and day difference between the symptoms that they're having before they seek treatment and after. So I love being able to they're like, wow, this is what I should actually feel like, okay? So after you get diagnosed and we send you to the medical professionals, they'll send you through a sleep study, and that can be done at the hospital or in your house, okay, depending on how healthy you are overall. They will talk through that different stuff, and if they do diagnose you with sleep apnea, the number one treatment for it is a CPAP machine, okay? It's a great option. It stands for positive airway, and it just keeps the airway open and allows you to get the oxygen that you need. But the problem with it is about 50% of people can't really tolerate it, okay? And if you're not wearing it for at least 4 hours, it's really not doing you any good. So what we can do is, if you can't tolerate it, if you're in that mild to moderate range of being diagnosed with sleep apnea, what we can do is actually make you an appliance that will actually move your jaw forward and allow you to get that oxygen and allow you to get that rest that you need to have so that you can conquer your day. So if any of these symptoms sound familiar, if your husband, significant other has any of them, talk to us. We're here to help you and just try and save lives.